single droplet of water cast into the vastness of the ocean will have a profound and unpredictable impact on the future of the system as a whole. In a dynamical system where action and reaction are entangled in an invisible web of relations, the results of the interactions between agents are complex and elusive. However, even amidst a sea of chaos, order can still be found if one decides to broaden the scope of their search. As we shift our perspective away from trying to understand the local interactions, patterns start to emerge, and a holistic depiction of the behavior of the system comes closer into our grasp.
A disruption to our complex yet fragile interconnected web, such as a pandemic, has led to a cascade of events, some of which include shortages in the distribution and manufacturing of medical or personal protective equipment, drugs, toilet paper, and life-saving ventilators. COVID-19 revealed structural flaws in the healthcare supply chain. Until December 2019, we had only heard of 6 coronaviruses which infect humans. COVID-19 is the 7th. After severe acute respiratory syndrome and Middle East respiratory syndrome, it is the 3rd zoonotic coronavirus, meaning it is transmitted to humans from animals. Like COVID-19, some can transmit from person to person, which tends to travel faster and further. Coronaviruses are respiratory illnesses which attack your lungs. COVID-19 causes a range of respiratory symptoms that can go from a dry cough and a fever to fatal viral pneumonia. This range of symptoms is partly the reason why it is extremely difficult to track the outbreak. We have seen that an individual can be infected with COVID-19 and show no symptoms. As a result, they don't visit a healthcare provider, get tested, or quarantine, simply because they don't even know that they are infected. The reality is, this is not the last major outbreak we're ever going to see, and it's the result of the way we human beings are interacting with our planet. For instance, deforestation has put us into contact with bacteria we have never encountered before, and now wild animals are relocating. Climate change has created a more humid and warmer climate, which is an ideal environment for bacteria to thrive. So a question we should all have is, how can we improve our response to an outbreak? We can't stop the outbreaks, but we can mitigate the outbreak by building our global health system, so that we are better able to detect spikes and manage allocation of scarce resources across the world. Our study provides a solution to alleviating the severe strain on the health supply chain through understanding at a larger scale the pattern of viral infection by using a remarkable strategy. Forecasting using machine learning models, more specifically non-negative matrix factorization and vector autoregression models, was employed to study the interaction between geographical locations and the advancement of infection. Accurate forecasting of early cases can be helpful in not only controlling domestic and international spread of an infectious agent, but also for preemptively moving resources to areas where we predict there may be a spike. To date, most computational models have focused on a single location, making it difficult to get accurate models to forecast the future trend of COVID-19 across the globe. In our paper, we show that countries around the world can be grouped into distinct clusters. From these clusters, we can extract patterns of viral spread, which may be reflective of international travels or levels of economic development. Furthermore, we were able to capture the pattern of viral spread within a specific country, such as the United States. Through leveraging this machine learning algorithm, we will be better able to predict where a spike may occur next based on where it is currently happening. As a result, scarce resources can be properly allocated to these regions preemptively.
In order to seek out patterns in these complex interactions, we employ a vector autoregression model to track the temporal evolution of daily COVID cases over 4,640 unique geographical locations across the globe. The advantage of the vector autoregression model over traditional forecast models, such as ARIMA, is that each time series is modeled not only after the previous values of itself, but also after the previous values of all the other time series within the system. This allows the complex interactions that exist across geographical locations to be described as a simultaneous system of equations. Now, the problem here is that fitting such a model is very computationally expensive. In fact, for a single lag order, there are over 21 million parameters that need to be fitted. So, in order to address this issue, a dimensionality reduction technique needs to be applied to the dataset in order to capture the core essence of the trends. We chose non-negative matrix factorization for this task. As the name implies, NNMF factorizes a time series into 2 matrices of positive values, which aptly describe the non-negative instances of COVID cases. In addition, the resulting matrices W and H correspond to the spatial and temporal dimensions respectively, allowing for a very straightforward interpretation of the results. Furthermore, the original time series can be easily reconstructed from these two matrices. Therefore, any prediction made by the vector autoregression model can be readily deployed across global localities.
Using non-negative matrix factorization, we were able to isolate 10 central feature components that best describe the temporal evolution of daily COVID-19 cases across diverse geographical locations. As we can see from the world view, distinct locations emerged as clusters across the globe. For instance, the USA and Central Europe fall under the same component feature. Similarly, Eastern Europe, India, and Central or South America belong to the same clusters. These patterns might be indicative of some similarities between the location within the same clusters, such as similar level of economic development or flow of international travel, etc. In addition to describing patterns across globe, this feature extraction method was able to capture the nuances within the countries. Centering on the United States of America, where the highest density of data points per country was found, we observed distinctly clustered regions which broadly encompassed the Midwest, South, and Northeast regions of the country. These results therefore indicate that non-negative matrix factorization was able to extract the descriptive features outlining both global and local interactions across geographical locations. To further investigate the temporal evolution of infection across space and time, we employed granular causality analysis. Using this, we were able to separate the components into an early and late stage of the virus spread. Arrows in this graph are indicating significant relationship between components. If we were to remove the edge between nodes 1 and 8 from the graph, the early and late stages would be disconnected. This is known as an articulation bridge. We therefore mark component 1 as an intermediate stage between the early and late components. Plotting the activation strength of these early, intermediate, and late stage components, it was revealed that the period between March and December 2020 served as an initiator of proliferation of the virus, which was followed by intermediate and later stages. With these spatial and temporal plots for evolution of infection, we tried to examine the geographical patterns which led to the spread. We plotted the geographical distributions of non-negative matrix factorization components, 8 for early stage, 1 for intermediate, and 7 for late stage over the United States. This revealed that the virus spread began along the northeast, south, and west regions of the country. During the intermediate stage, the Midwest regions were most affected, and for the late stage, the virus spread back to similar regions as early stage. These results were surprisingly consistent with the William Frey analysis for the confirmed COVID-19 cases, which also show that in March and April, infection was largely centered around the greater New York and New England, and in July, it had spread to the south and west areas of the country. We evaluated the accuracy of a model by reserving a given number of days, up to 60 days for testing, and fitted the model on all previous days. Results show that a model is able to forecast a time series trend for up to 30 days with a Pearson correlation of over 80% and an absolute percentage error of less than 10%. These results demonstrate our model's ability to describe the spatial temporal patterns of viral spread. It revealed both global and local levels of interaction over the spatial dimension. For temporal dimension, granular causality analysis helped us identify different stages of viral proliferation. COVID-19 had a profound impact on social, health, and economic well-being of people all across the globe. Disruptions that started as small localized events spread quickly far and wide all across the world. With over 500 million confirmed cases and 6 million deaths, the past 2 years of COVID-19 pandemic have made us reevaluate our healthcare system, policies, and readiness in handling a health crisis. It has signaled the need to develop better prediction systems to help improve the decision-making and policy enactments. But in order to develop an accurate prediction model and to prevent infectious disease from spreading, it is paramount to understand the origin and complex dynamics underlying the flow of antigen across geographical location. Our model helped to study these complex dynamics by describing spatial temporal patterns of COVID-19 propagation across the globe. Having a tool like this can help us isolate the focal points where our efforts and resources would be used most effectively to contain the proliferation of virus, which can help us avoid a crisis like this in future.
In the end, we would like to thank NSERC and CIHR,
Government of Alberta and University of Ritwik for their generous scholarship support.
We'd also like to thank the organizers of the Inter-University Big Data Challenge for giving us this opportunity.